to the 2021 American Diabetes Association Ask the Expert series. Today's topic is Optician, Optometrist, Ophthalmologist. Who do I see? Remember that our Ask the Expert series is all about answering questions from our listeners, so start getting your questions ready. For those of you on the phone, press *3 on your keypad and an operator will collect your question and place you in the queue so that you may have an opportunity to ask your question live. Participate online, type in your name and question in the fields below the streaming player. Press the Submit Question button and your question will come directly to us. Stay with us through the hour and we will send you useful resources to help you live well on your journey with diabetes. We invite you to provide us with your feedback in our 5-question survey at the end of the event. Okay, now a little bit why we're here today. The American Diabetes Association, together with visionary partners, VSP, Vision Care, and Regeneron Pharmaceuticals Incorporated, is focusing on an often overlooked but costly and devastating complication of diabetes, vision loss. This eye health initiative, Focus on Diabetes, provides tools and resources for people with diabetes to learn how to reduce their risk of developing eye disease by managing glucose values and getting an annual comprehensive dilated eye exam, even if symptoms are not present. As part of the initiative, the ADA is holding this free educational Q&A. We'll cover information to help you take charge of your health. The health and safety of all those we serve at the ADA is always our top priority, and the CDC has determined that COVID-19 is a serious public health threat. In general, people with diabetes face a greater risk of complications when dealing with any viral infection, and that is true of COVID-19 as well. The ADA encourages people with diabetes to get vaccinated, and if you have questions about the vaccination, talk to your healthcare provider. ADA also encourages you to follow the guidance of the CDC and to contact your medical provider if you suspect that you are showing any signs or symptoms or have been exposed to COVID-19. For our most up-to-date information, please visit our website at diabetes.org/coronavirus or call 1-800-DIABETES, which is 1-800-342-2383. And now I am happy to introduce our guest for today's event, and we are lucky to have 3. We've never done this before. We're delighted. Pamela Luama, ABO certified optician, has been working in the metro area for 33 years, currently working as a dispensing optician at Grin Eye Care in Leawood, Kansas. Dr. Jeffrey Gerson graduated from Indiana University School of Optometry in 1997 and completed his residency concentrating on low vision and ocular disease. He sees primary care patients and has an emphasis on retinal care in his practice in Olathe, Kansas, and he has been on our program multiple times. We welcome him back. Dr. Heiniger completed his internship at John Peter Smith Hospital in Fort Worth, Texas, and his residency in ophthalmology at UT Southwestern Medical Center in Dallas, Texas. During his time in residency, Dr. Heiniger served as both clinic chief and surgery chief resident. At Grin Eye Care, he practices comprehensive ophthalmology with an emphasis on cataract and refractive surgery, and he manages many conditions of the eye, including glaucoma, diabetic eye disease, droopy eyelids, dry eyes, and macular degeneration. So we have a wonderful assortment of people to help you out today. As we are waiting for our callers and online listeners to chime in, I'm going to go ahead and kick off with the first question. How would you advise knowing which eye care specialist to go to when you are confused? And maybe each one of you could briefly describe who you would see. So let's start with Pam.
First of all, I would call different offices and ask what their specialties were, services they provided, what their qualifications were, if they had like modern technology and equipment. And then I would probably go online and see what kind of reviews each one of those doctors received.
Great, thank you. Okay, Dr. Gerson.
Yeah, so I think obviously it's going to be a little different for everybody, and part of it is going to depend on your insurance. because a lot of drives who comes in or who they see is who's covered on their insurance plan. So I think that's something that's important to look at. But what I would tell you is that in general, for people with diabetes, for general routine eye care, that they're perfectly fine to see either an optometrist or an ophthalmologist. However, for example, someone's been told they have cataracts and might need surgery or have a retina condition that requires treatment, then they're going to be better off starting with an ophthalmologist like Dr. Heinegger.
Great, thank you. Dr. Heinegger, please put out your comment.
Yeah, I mean, I would agree with what's already been said. I mean, it partially depends on where you are in the process. I mean, if you're just looking for a screening exam, then like Dr. Gerst said, you can see an ophthalmologist or an optometrist. But if you have previously been diagnosed, or if you have some suspicion that you have a medical condition or a surgical condition that needs treatment, then an ophthalmologist is the first you need to see. And checking in terms of who to see, getting referrals from your primary care doctor. They often have a good idea of what providers are in the area. Friends and family may be able to recommend what eye doctor they have seen in the past, or if they've needed medical treatment or surgical treatment, what doctors they would recommend and have had good experiences with.
Thank you. And I think that the take-home message from this whole session will be make sure you see someone. The idea is if you have diabetes, make sure that you're seen on a regular basis, and we'll talk more about why that is. Okay, we're going to start to go to online questions, and we're going to start with Andrew. Andrew from Rochester. Andrew, you're online.
Oh, hello. Yes, I'm just wondering what the chances are of someone being diabetic starting to lose their eyesight.
Okay, Dr. Gershon, you want to answer that one?
Sure. So it's a really good question because it's something that obviously people worry about. And I think, I think the way that I would approach a question like this is a little bit differently in saying, how can someone with diabetes help prevent diabetes-related eye problems or losing their vision? And so the messaging that you would be hearing from any of us regarding that would be the same as what you hear from your primary care physician or endocrinologist, which is doing the best that you can to control your blood glucose and doing the best that you can to control your blood pressure and other systemic condition. And so when that's done, then the likelihood of having vision loss from diabetes is relatively low. The other thing that I would mention as far as vision loss is when changes are caught early enough, if they require treatment, then generally that treatment will prevent vision loss. So kind of like what was already mentioned is making sure to have routine care, because oftentimes there are changes in the eyes that are present even before you notice it with your vision. And the whole key is finding those changes before it affects your vision, and ideally getting it treated before it affects your vision and not waiting until after it does.
Great, thank you. Oh, wait, okay, we have a question from Muriel. Muriel, what is your question? And I think this one is going to go to you, Dr. Heinegger.
Yes, I'm calling about the ophthalmologist in the group. I have macular degeneration, and I'm receiving injections into the one eye. And I'm wondering if that's going to preserve or possibly improve my vision in that eye, or just keep it from getting worse.
Yeah, great question. So yeah, what you're talking about there is what we call wet macular degeneration. So in folks that have age-related macular degeneration, there is the dry form, which is the kind of earlier, less quickly progressive form, and then the wet form. And people can get injections for the wet form of macular degeneration. And so what I tell patients, because I do some of these injections in my clinic, what I tell people is the first primary goal of the injections for macular degeneration is to prevent further vision loss. Our primary goal is to keep you from losing additional vision in that eye. And the injections are, by and large, very, very effective at doing that. Now, some people do also regain some vision or improve their vision. Part of that depends on, at what stage your disease was caught, and depends on how your eye responds to the injections. But goal one is to keep your vision steady, keep you from losing additional vision. Goal two is to hopefully gain some vision back. And a lot of times patients do. Oftentimes the vision does not return to your original baseline, but it is possible to regain some vision. Before these injections, were developed, and these injections have been around, about 15 years, 15 years, give or take. There was no treatment for wet macular degeneration, and so, the current standard of treatment is a big improvement on what existed, just a couple of decades ago.
Thank you. We have a question from Jane, and Jane, this is directed to you, Pam.
Yeah, I had a friend tell me I could get a readout on my prescription for my glasses and get them cheaper at some place like Walmart. And I was wondering, though, is it better just to get them at my doctor's office? Therefore, I feel like I'm sure I'll get the right prescription.
Well, that's interesting because I think overall it makes it easier on you if you do get your glasses at your doctor's office, because everything can be handled in one place. And it just makes it easier on you.
Great. Okay, we have a question coming in from Patrick. Patrick, you're on the line.
Oh, I have developed, I'm 82, I've had type 2 diabetes for about 30 years. I see the eye doctor every year, but I've just started to develop a gray floater in one of my eyes, and I'm wondering what the heck is going on.
Yeah, I can tackle this one. So,
Yeah.
I deal with a lot of floaters in my clinic. The floaters are normal. Most of the people, by 80, 90 years of age, 90, 95% of people have some floaters. It's very, very common. What's happening? So the back part of your eye is filled with gel. It's called the vitreous. When we're first born, that's like a solid block of jello. As we get older, it kind of liquefies. And as that happens, you develop these little clumps of that gel, essentially. And so that's what you're seeing with the floaters. Floaters themselves don't mean anything bad. It's just indicative of that normal process of change in that gel as you get older. Over time, one of two things happens. Either the gel, that floater floats out of your vision, or your brain learns to ignore it. In a small percentage of people, the floaters are still there, and they can be bothersome. There are some treatments for those floaters, one of which is a laser procedure that can be done to essentially vaporize those floaters. So floaters themselves are very normal. They're common. They don't mean anything bad. Now, if the floater that you've developed is new, a new floater, the process of that means there's being changes in that gel. And that can sometimes lead to a retinal tear, and very rarely a retinal detachment. So if you've developed new floaters, or if you've developed floaters and flashes of light, then it's a good idea to go in and have either your optometrist or your ophthalmologist take a look at your eyes.
Great, thank you. And if you're just joining us, welcome to today's Ask the Experts Q&A. Optician, optometrist, ophthalmologist, who should I see? As a reminder for those of you on the phone, press *3, that's *3 on your keypad, and an operator will collect your question and place you in the queue so that you may have the opportunity to ask the question live. To participate online, type in your name and question in the field below the streaming player. Press the Submit Question button, and your question will come directly to us. So we have a question coming in from Jackie, and she's questioning who she should be seeing. So maybe she can enlighten us on what situation she has. Jackie?
Thank you. When I first became diabetic, my doctor said I had the best disease I could have because I was in complete control. I'm an 84-year-old, a 43-year survivor of diabetes with a current A1C of 5.7. My doctor of 4 months is a glaucoma specialist. Now, I had cataracts removed about 15 and 10 years ago. In both cases, I had an AION, high blood pressure. They put a stent in the second eye. I currently have glaucoma in both eyes and macular degeneration in one eye. I have I have very little peripheral vision. I am told I have no signs of diabetic eye problems. I was also told I had a vascular problem that would result in blindness. Do I have the right type of doctor, the glaucoma specialist? If it is a vascular, should I also be with a heart doctor, or is there an eye doctor that specializes in vascular eye problems? I've worked very hard to control my sugar levels to avoid these eye problems, but I have them.
I'll try to take this. So that's a lot going on. I think that's I think the first thing that I would say. So it's a tricky question. And if you say there's some sort of a vascular problem, if that's something systemic, then that's not necessarily an eye doctor. There's not a specific vascular eye doctor. So that sounds like it's more cardiologist or something else, or an internist that may be able to guide you there. It sounds like from the eye conditions that you have that a glaucoma specialist would likely be a good person to be seeing, and that if there's something that they see that they're not comfortable with, they could refer you to somebody else. The two other things, though, that I would point out to you, depending on what your vision is at this point, one thing to keep in mind for anybody that has any significant vision loss or is not able to function as well as they used to be able to, is there are eye doctors that do what's called low vision. And so these are doctors that don't necessarily provide new or different medical treatments, but doctors that help you find different devices, whether they be magnifiers, something high tech or something low tech, to help you to be able to function better for reading or possibly even distance vision. So I think that's one thing, again, depending on what your vision is or any of the other listeners that have decreased vision, to find a low vision specialist. And then, the other thing that I would point out is, so with Pam being an optician, oftentimes subtleties with glasses can make a big difference. And so anytime, again, whether it's for you or someone else, if there's issues with glasses, then I think it's important to realize that it's one thing to receive the medical care you need, but also to make sure that the glasses you have are what they really need to be and are adjusted and are of the right quality.
Great, thank you. We have a call coming in from Walter from California.
Yes, I've had type 2 diabetes for several years, and now I also have glaucoma. But now I have a problem where my right eye just secretes fluid. And I wake up in the morning and sometimes my eye has secreted fluid to the point where it has dried and it's hard to open my eye because of the eyelid sealing. And I've talked to 2 or 3 doctors and it seems like none of them know what's going on. You have any advice for me?
Yeah,
Dr.
so I mean, I
Heineck?
think, when it comes to basically a watery eye, there are several different common causes for that, and it really would come down to the examination of your eye, and it's always good, always a good idea to get multiple opinions if you're not satisfied with the opinions that you've been given previously. But this could be dry eye, believe it or not. A watery eye often indicates that the eye is actually dry. It is your body's attempt to make it more wet by making more tears. And so an eye that waters sometimes is just a very dry eye. It could be something to do with the tear drainage system of the eye. Sometimes people can develop blockages in their tear drainage system over time, and that can lead to excessive watering or tearing. Or it could also be that the eyelids themselves are either have become kind of loose over time or are not quite in the right position anymore, and that is affecting the closure of your eye at nighttime, or once again the tear drainage qualities of your eye. So those are the most common causes when it comes to a watery eye. You could consider seeing, there's something called an oculoplastic specialist, which is essentially a plastic surgeon of the eyelid. And they may, if it did have to do with the eyelid, they may have some insight into it.
Thank you. Paula has a question. She's from Denver, and I think this goes to you, Pam. Paula, you're on the line.
Yes. I have had diabetes for about 27 years, and I was told that I have low vision. I'm also legally blind now. I'm needing to know, how do I get a hold of a vision specialist so that I can make best of the vision I still have?
I don't know that that's a question for me.
So let me take that one. So probably the easiest thing that either you can do or have a friend or family member do is just in your local area, Google low vision providers. And so depending on where you live, if you live in a metropolitan area, there's likely to be someone that provides low vision services. If you currently have an eye doctor, whether it's an optometrist or ophthalmologist, then it's very likely that they would know who in their local area provides low vision services. So I would start with either something as simple as a Google search, or by going to your current provider and just asking them for a recommendation.
Great, thank you. This question comes from Gail. Gail from Florida.
Yes. Hello. I'm Gail
Hi.
from Jacksonville, Florida. Hi, and I have a question because I now have developed neuropathy in my eyes a little bit, and I believe I had high sugars in the past, but this summer, unfortunately, I had gotten COVID, and I was in the hospital for a little while, but then I was able to go home, but I still had to treat myself with the prednisone steroids, and as a result, my sugars went up kind of high. And I had troubles regulating the sugars on my own. And so now I just went to the eye doctor this week, as a matter of fact, and I was told that my vision, I knew my vision had changed, but now it has changed. And so he said I have the neuropathy starting with my eyes. So I was wondering, is there anything that I could do to prevent further blindness or losing my sight? Would shots with injections help me in addition to?
Dr. Heidegger, I think that's for you.
Yeah. So I'm not sure if she means neuropathy or retinopathy. Retinopathy is the more common condition of the eye, and I think that's probably what she's alluding to there. So there are different levels of retinopathy, or changes from diabetes within the eye. Mild, moderate, and severe non-proliferative, and then something called proliferative. And so usually people, kind of go through the stages from one to the other. If the changes are mild at this point, then usually the first treatment is just, more tight control of the blood sugars. So, like Dr. Gerson alluded to earlier, following up with your primary care doctor or your endocrinologist, and just keeping tighter control of the glucose levels. And then just regular screening with your eye care provider. I mean, that's kind of the most important thing as you're just starting to develop, retinopathy or changes from diabetes in the eye, is just to continue close follow up with your doctor. The injection, so that your eye care provider will be able to, both by exam and by doing testing in the office, be able to tell if there are changes that warrant any injections or lasers or treatment on your eye itself. typically those are treatments that are reserved until there is a certain level of retinopathy within your eye, and your eye care provider will be able to let you know.
Great, thank you. And a question coming from Mary from Ohio. Mary.
Hello?
Hello, Mary. What is your question?
Would someone please discuss cataracts and the removal of, by whom should it be done? Removal of cataracts and who should do it?
Thank you.
I'm going to start that one, but then I'm going to hand it off. And the reason that I want to start that one is as an optometrist, I don't do cataract surgery. And as it turns out, the vast majority of my patients that need cataract surgery, I refer to Dr. Heiniger, who's an ophthalmologist. So I'm going to let him answer it. But the one thing that I want to point out that I think sounds better coming from me as not being the actual surgeon is that what I can tell you is in the hands of a good cataract surgeon, that the surgery is quite simple for most people to go through, and most people have incredible results and see fantastic afterwards. So I just wanted to say that because it sounds better coming from me than from the actual surgeon, because then it sounds like they're promoting themselves. But so I'll let Dr. Heiniger take over the rest of the questions as far as, what are cataracts and what's the surgery like?
Yeah, so cataract is just the lens in the eye getting cloudy. So your eye has a lens. Your eye, in a lot of ways, is similar to a very sophisticated camera. It has a lens in there, and that lens over time gets cloudy. And that's what a cataract is. That's normal. That happens to everybody as we get older. If you live long enough, you will get cataracts in your eyes. And then it becomes a matter of how much are those cataracts bothering you. And the things people tend to notice first are difficulty driving at nighttime, glare with oncoming headlights, difficulty reading small print, difficulty reading in dim lighting, your glasses just not working as well as they once did, even with your best pair of glasses that your eye care provider can give you. Those are the signs of your cataracts getting bad enough that they need something done with. And the solution for that is cataract surgery. And cataract surgery, essentially, it's just a lens exchange surgery. We take out the cloudy lens, the cataract, and we put in a clear lens implant. And the benefit of that is to allow you to see better. And it's accomplished in a couple of different ways. And without getting into too great a detail, essentially, your vision improves because the cataract is gone, and you can see better because the cataract is gone. But we can also correct a lot of your prescription or your refractive error. And so a lot of people after cataract surgery need glasses a lot less, to a less extent than they did before. Some people are able to get rid of glasses altogether, depending on what kind of lens implant we put in there. And so it's a very, like Dr. Gerson said, it's a very, very cool surgery. I tell patients it's a fun surgery. I don't know if they believe me when I say that, but it is. I mean, people by and large are very, very happy after cataract surgery.
Great. So, Pam, maybe you can answer this question for us. An individual wrote in and said that they have a prescription for glasses. That's question number one. Where do they go? And question number two, they've been told to wear sunglasses when they go outside. Could you explain why that would be as well?
What was the first question?
They have a prescription for glasses and want to know who they would see.
They would see an optician. Usually if you get a prescription, like if Dr. Gerson gives somebody a prescription after cataract surgery or Dr. Heiniger, they come over to the optical department and I fit them for glasses. It's best to do it all in one place. That way, if there is an issue, it can be corrected pretty quick. Sunglasses need to be worn outside because they have the UV 400 protection, which is what our eyes need to protect us from the ultraviolet. So that is a must. Some of your materials in the glasses, you can have that added afterwards, like if you don't need a prescription. You can simply have sunglasses made, or you can buy a pair of polarized glasses that have UV protection in them. They're usually available anywhere, but you should see your optician.
So I'm just going to, again, kind of like I did when Dr. Heiniger was talking about cataracts, I want to make a quick comment here because, again, Pam, I think, will undersell herself or opticians a little bit. And I think a lot of people just don't realize how important it is to have an experienced, really good optician that can make a difference. Because if Dr. Heiniger or I give someone a prescription for glasses and they take it somewhere where an optician or the person that's fitting the glasses isn't really an optician, if they don't know what they're doing, then it doesn't matter how good the prescription is that we gave them. The glasses won't end up really very, very good. You won't like the glasses. So the end product and how well you ultimately see is oftentimes very much affected by the quality of the optician and the quality of the lenses and overall glasses that they help you choose.
Yeah, good. Okay, we have a question coming in from Daniel. Daniel's from Washington, D.C.
Hello, I'm Daniel, and I'm calling regarding maybe 3 parts of my care for my prescription from the from the optometrist, and the same team is in the same office, and I asked them to do a copy of my prescription because I don't have the ARC and I don't have the polarizing feature, on my prescription. So it looks like I'm having a problem because the earpiece on the left and right side doesn't keep the frame from sliding down my nose, the bridge of my nose. And also, I have bifocals, and when I drive, it looks like I'm seeing through that dead spot between the lens and the bifocal. So it looks like they gave me a copy, but the lens is not in the vertical axis, able to handle the bifocal portion. So I guess I have a sort of like a potpourri of issues surrounding, what is available, as far as the mechanics, not so much care of the eye, but the mechanics in the vision world. Thank you.
We could start by checking your prescription with what was prescribed and making sure that the glasses are made correctly. And then it could be something as simple as an adjustment of the nose pads and the earpieces to get the glasses sitting on you where you need them to be to use them well.
Great. So we have a question coming in from Pam. Pam is from Michigan. Pam, you're on the line.
Hi, I have 2 questions. I have sparkles every day, and I'm wondering what's happening, and also, is there any way I can, prevent these things happening? And I'm wondering what is going to happen to me in future.
So is that, just so I make sure I heard that correctly, is that I'm seeing sparkles?
Yes, that's correct.
Okay. So that's likely very similar to something Dr. Heiniger already talked about when he was talking about floaters. So a lot of times if you're seeing sparkles, it has something to do with the gel, the vitreous in your eye, like what he was talking about. And so sometimes we see little flashes or little sparkles as that gel is pulling itself away before it actually pulls away and before you actually see the floaters. But what I would really highly recommend, if someone's seeing any new flashes of light or sparkles or things floating in their vision, to contact your eye care provider, let them know, and they'll likely have you come in to see them in fairly short order. It may not be that same day, but it'll likely be within a couple days to make sure that it's not anything to worry about. But I think that's something worth getting checked. for peace of mind and to know that there's not a problem. What we worry about is that it could potentially be something called a retinal detachment, which is not very common, but it's something that if it's caught early, people generally do quite well. So I think the bottom line is, at any point, if you have questions about something like this or something else that doesn't seem right with your eyes, the way they feel or the way you're seeing things, to contact your eye care provider and get it checked out.
Thank you.
Yeah, I'll interject and say as well, the other thing, another very common cause of sparkles, and some of this depends on how, the sparkles that Dr. Gerson was just talking about are kind of instantaneous, very quick, very rapid sparkles. People can also get something called an optic migraine or an ocular migraine, and that can look like sparkles are shimmering, or it can have differing looks to it, but that tends to last a little longer. That lasts somewhere between 10 and 60 minutes, and that is sometimes a little alarming to folks at first, but generally is very benign, is not anything to worry about. But either way, like Dr. Gerson said, anytime it comes to any question about your eyes, it's always better to just err on the side of caution and contact your local eye care provider.
Thank you. And I think this should be for Dr. Heiniger, since you're the one doing the surgeries. This comes in from Carolyn from Connecticut.
I wondered, once you have cataracts removed, can they regrow?
Yeah, excellent question, and one we get very commonly. No, you only need cataract surgery once. Once those cataracts have been removed, they will not come back.
Okay, great. So I have a question coming in from Nancy from Ohio. Nancy.
Hi. I recently retired and had a change in insurance, and simultaneously, the optometrist that I've been seeing for probably 20 years has announced his retirement. And he has taken me through several things that have happened with my eyes over the years, and including my diabetes issues. I'm wondering, as I have to pick a new provider with the new insurance, should I make an effort to get medical records from my long-term doctor to take with me, or do I just go to someone new and start from scratch, considering, some of the medical issues?
I think what I would say is it's oftentimes helpful to have some of the background. And sometimes you as a patient may be very good at letting us know what's gone on, what the conditions have been, what, if any, treatment you've had. But sometimes it's difficult to remember or know the technical names or some of the subtleties and differences of the diagnoses or treatment. So I would tell you that if you can get medical records, that sometimes that's very helpful. But I would also tell you that I wouldn't delay care or get too worried if you can't. But it certainly is nice if we can kind of see what's happened historically, because it also helps us to know whether there's been any change, or maybe if you've tried something in the past and it did or didn't work. That's always really good to know. So to me, the bottom line would be, if I could have medical records in a case like yours, that would be great. But even if we couldn't, we'd still be able to take care of you.
Thank you. Here's a question for Pam, I believe. This comes in from Emma from Texas. Emma, you're on the line.
Hello, Pam. I have macular degeneration. I have lost the central vision in my left eye, but still have some vision in my right. I've been trying to find magnifying glass to help me read menus in restaurants, and I'm up to 45 magnification, but I can't find anything any larger, and I just can't read anymore.
So I believe she's looking for an answer to how could she get some stronger ones?
Dr. Gerson stated earlier that probably the simplest thing to do would be to try and Google it and see if you can, or get somebody to do it for you. Just Google low vision aids, largest magnifier. That's
Yeah. So one of the things that I'll add is, as the power of the magnifiers goes up, the size of the actual magnifier will always go down. So when you go stronger and stronger, they become smaller and smaller. So anyone that practices low vision, besides having traditional magnifiers like what you're thinking of or what you might be able to purchase at a store, will also have access or be able to tell you about different digital magnifiers, where it does it digitally, not just with a regular lens. And by the way, the most common and oftentimes best digital magnifier, you probably already have it. So if you have a smartphone, it likely already has in it the ability to act as a magnifier by using the camera in the phone and by being able to manipulate the images on the screen. Oftentimes that's a fantastic visual aid. So I would tell you to start with your phone, and beyond that, like Pam said, to Google a low vision provider.
Thank you. I have a question about glasses coming in. This is from Margaret from Florida.
Hi, thanks for taking my call. I go to a place where you get 2 pairs of glasses for like $69. And one pair would be like for distance and one would be for reading. My question is, if you get the 2 into 1, I've had problems in the past with bifocals, so I prefer to get the 2 separate pairs. Of course, the bifocals cost more, and I'm also interested in sunglasses or progressive glasses, I think they're called. Can you enlighten me on the differences and what would be best for me?
separate pair.
Do you think the separate pair is better? Is that what you're saying? Or bifocals or progressive?
How long have you been wearing the 2 separate pair? For how many years?
She's not on the line anymore, so you'll have to assume.
Okay. So the 2 separate pair, if you've been wearing them for quite some time, I would probably stay with that. Sometimes it's harder to get used to something as we get older. We just don't like change. If you wore a lined bifocal, the difference between those and a progressive lens is, with a lined bifocal, you have distance and you have reading just like your 2 separate pair. But with a progressive lens, you also have an intermediate. So there's no line. You have that mid-range for your computer, but everything is narrower too. So if your purpose is to see better and see more, which it probably is, you're better off to stay with the distance and the reading, and possibly even maybe get a weaker pair of reading glasses for your computer monitor if you use a computer.
Thank you. We have a question now coming in from Nancy.
Okay.
Nancy, you're on the line.
Yeah, I think that's pretty much it for now. Do you have any questions for?
No.
All right. Thanks so much for your time, Nancy. Have
Thank
a great
you.
day ahead.
You
Bye-bye.
too. Yeah, bye-bye.
Okay. Bye-bye.
Bye.
Nancy, you're on the line. So my statement from Nancy, are you there? The comment is...
Hello, can you hear me?
Yes, I can now. Thank you. Yes.
Okay. Sorry about that.
No worries.
I was wondering about my I have the eyes, the grittiness in the eyes, and my doctor has said I have dry eye, and I am a type 2 diabetic.
and my eyes are it's like I have a sandiness in the eyes, especially in the morning. So I have to take a warm washcloth and wipe my eyes out real good. But throughout the day, it itches sometimes, and then and then that grittiness drives me crazy. Is there something else that I should be doing? If you could help me with that, I'd appreciate it.
Yeah, so dry eyes are very, very common, and especially in folks with diabetes, dry eyes is an extremely common problem. And it is common to have a kind of gritty feeling. I think that is probably dry eye. There are many different ways to go about treating dry eye. The bad thing about dry eye is there's no single magic bullet or no cure for dry eye. So the treatments are all aimed at managing your symptoms, trying to get your eyes as comfortable and seeing as clearly as they can. The first things we usually have folks start with are over-the-counter treatments, artificial tears. You want to stay away from products that say like get the red out. Those often have ingredients in them that can make your dry eye worse over time. So you want to stay away from those products, but just any good regular over-the-counter artificial tear. A warm compress over the eye can be very helpful for dry eye. If the problem tends to be first thing in the morning, there are ointments or gels that you can put in at nighttime. And you just put a little bit of that in at nighttime before you go to bed. That really lubricates the eye and helps keep it from drying out at nighttime while you sleep. So those over-the-counter treatments are usually what we tell people to start with. Sometimes people are still struggling after that. There are lots of other things that you can try. If you're to that point, you can talk to your eye care provider about prescribing. There are prescription dry eye treatments, dry eye drops. There are little plugs that can be put into your tear drain to kind of keep the tears that you make around longer in your eye. So there's lots of different things they can try, but usually you start with the over-the-counter treatments, and if you're still struggling, then contact your eye care provider.
Thank you. This question comes in from George from New Jersey. George, you're on the phone.
Yes. I had a cataract removed from one of my eyes about a year ago, and I never got back the color in my sight. It looks like I'm most times with that eye looking at a TV program that's 50 years old, and the other eye is okay. But then if I use both eyes, I see it with color. But the left eye alone, I no longer see the color. Can that be restored, the color?
Yeah, that's it's a good question. So it's hard to say without doing a complete exam and some testing exactly what the cause for that is. You know, sometimes after cataract surgery, people can develop a little film that grows behind the lens implant. Some people call that a secondary cataract or an after cataract. It's not really a cataract, it's kind of a different process. But if that's the case, the fix for that is a quick laser procedure that can be done in the office, where you open up that film and you can see through it more clearly again. So sometimes that process can cause distortion of color or make things seem blurred or dull after the cataract surgery. There are other things that can cause changes in color in the eye. Some of them might have to do with the lens that was implanted itself. Sometimes there can be damage to the optic nerve, which is the nerve that takes the signal from the eye to the brain during or shortly after cataract surgery. So probably the best thing is to visit with your eye care provider, and they can do some testing and testing and exam to figure out what is the cause of that, and if some of those causes, like I mentioned, are treatable and correctable. If it's an event that caused damage to your optic nerve, that is generally not correctable, although sometimes gets a little better with time.
Thank you. We have a question coming in from Chris. Chris is from Florida. Chris, you're on the phone.
Yes, hi. It's kind of a complicated situation that I had. My optometrist saw me back in June of 2020, and he had a retina machine, and he told me that there might be a retina tear and I should see a specialist. So I called my insurance. They found me a specialist. I checked him out online. Very good credentials. So I saw him, and the next day, and he told me there was a problem, but it wasn't a big problem, and he could see me in 10 days. He saw me in 10 days after that, and he told me the retina detachment was evident. So he scheduled the surgery for the next day. So it was like June 18th or something. And he did put an oil bubble and gas bubble in the eye so my system could absorb it and avoid the second surgery. But then I had developed a cataract, and another doctor in the same firm did cataract surgery. My vision was still bad. I saw the first doctor, the retina specialist, again as a follow-up, and he told me that wasn't working that good, the first gas bubble, because I had some tremors in my head, and I guess he said he can use the silicone now because it's going to hold the retina. I had the cataract surgery September, and then I had another retina surgery in December of 2020. And he said that went well. I saw him for follow-ups, but then he left the firm. The follow-ups, he was saying it was good, but still I couldn't see very well. I went back to the first firm, the doctor that did the cataract, and he told me he can do membrane surgery, secondary cataract surgery, and he did that back in August of this year. After that, I still couldn't see good, and he sent me to another retina specialist, and they said, you have one very healthy eye, but the other eye, they found some scratches in the retina. So I see distorted. My left eye is very good 20/20, but on the right eye, which everything was going on, is still the vision is still distorted. I see some lines. Anything I can do and pursue another treatment or with vitamins? That's my question.
Thank you. I think that probably goes to Dr. Heiniger.
Yes. Yeah. So unfortunately, it sounds like, this eye has been through a lot. Retinal detachment and then multiple surgeries and all and to me, it sounds like all those doctors were taking very good care of your eye, and that all sounds very appropriate. Sometimes despite our best efforts, when an eye is very sick or has been through a lot, sometimes the eye just doesn't heal as we would like. In any time your eye has had a major event like a retinal detachment, especially what sounds like was kind of a complicated retinal detachment, it's always possible with that sort of event in an eye that the vision may not return to 20/20 or may not return as good as it is in the other eye or as good as it was previously. I think you're seeing all the right specialists. I think if the retina specialists have decided or determined that that's all the better, or all the that's your kind of your potential of what that eye can see, then sometimes there's just not much more that can be done. Sometimes the risk, when we talk about doing surgery with patients or doing additional procedures, it always comes down to the risk versus the benefit. And at a certain point, sometimes the risk of an additional procedure outweighs the benefit. Now, as they've told you, I'm sure, the main thing, you have that one healthy eye, and you got to do your best to, keep your regular follow-up and keep that left eye seeing as well as it can.
Thank you. So we have run out of time, but I would like each of you individually to briefly give one take-home point you want listeners to remember from today's event. So we'll start with Pam, and then we'll go to Dr. Gershon and Dr. Heiniger. So Pam, what take-home message do you want people to remember?
Definitely stay getting your yearly routine exam, your comprehensive exam from your eye doctor, whether it be an ophthalmologist, an optometrist. Don't miss them.
Great. Dr. Gershon?
So I would say that Pam took my main takeaway. And so since she took mine, I'll say what I would have expected Pam to say. And that is to realize that not only does it matter the doctor that you see, but also the optician, the person that takes care of and makes your glasses, is oftentimes a really undervalued part of your eye care team. And that it doesn't, like I mentioned earlier, sometimes it doesn't matter how good of a job Dr. Heiniger or I do in finding out what your prescription is. Without a good optician, then oftentimes our prescriptions aren't nearly as valuable. So don't underestimate the value of a experienced and really good optician.
Great. Dr. Heiniger?
Yeah, I think the biggest take-home point, when it comes to diabetic eye disease or eye health in diabetic patients, the main thing is prevention. Keep your regularly scheduled yearly appointments with your eye care providers. Continue following up with your primary care doctors and your endocrinologist, and keep that blood sugar control as good as you can, because that's ultimately what drives the boat when it comes to your eye health and diabetes.
Great. Thank you, all three of you. A few items before we close for today. Consider staying online or on the phone to complete a short 5-question survey. We want to hear from all of you and hope you will take a few minutes to provide us with your useful feedback. To help you feel confident about your ability to prevent and treat diabetes-related eye disease, we encourage you and your loved ones to talk to your healthcare provider about your risk, schedule an annual dilated eye exam, whether you have symptoms or not, and register for the next event at diabetes.org/experts. All these links are on the Ask the Expert registration page. Once again, diabetes.org/experts. Thank you again for joining us. We appreciate your feedback on today's event. To provide your responses, press the corresponding number on the keypad of your phone. For participants online, please click on the poll section below the Ask the Question form and click to submit your response. Okay, here is the first question. Keeping glucose, lipids, which is blood fats, and blood pressure in target range reduces the risk of developing eye disease. Press 1 for yes, press 2 for no, and press 3 for I don't know. I will ask that question again. Keeping glucose, lipids, and blood pressure in target range reduces the risk of developing eye disease. Press 1 for yes, press 2 for no, and press 3 for I don't know. While we take a moment for the next question to come up, I would like to let you know if you missed part of today's event or would just like to listen again, we have full recordings available by phone. Call the toll-free number 866-686-8240 to hear the latest recording. Okay, on to question number 2. How frequently should a person with diabetes get a dilated eye exam? Answer number 1, press every 6 months. Number 2, every 1 to 2 years. Number 3, every 5 years. Number 4, only when vision is affected. And number 5, I don't know. Again, how frequently should a person with diabetes get a dilated eye exam? Number 1, every 6 months. Number 2, every 1 to 2 years. Number 3, every 5 years. Number 4, only when vision is affected. And number 5, I don't know. Before we go on to question 3, remember that our next Ask the Experts event will be held November 9 at 2 p.m. Eastern Time. Our experts will discuss finding the support from a diabetes educator. To register, go to diabetes.org/experts or contact us at 1-800-342-2383. And here's question number 3. True or false, diabetes eye-related diseases can have no visual signs or symptoms? Press 1 for true, press 2 for false, and press 3 for I don't know. Once again, question 3. True or false, diabetes-related eye diseases can have no visual signs or symptoms? Press 1 for true, press 2 for false, and press 3 for I don't know. While we wait for question 4 to load, I'd like to let you know that you can find resources related to this event on our website, diabetes.org/experts. Click on the October 26 event page under past recordings to find links to our eye health resources, as well as the full recording of the event. Okay, now for our final question, number 4. To what extent do you feel confident that you can reduce your risk for diabetes eye-related disease? Number 1, not confident. Number 2, somewhat confident. Number 3, very confident. Again, number 4, to what extent do you feel confident that you can reduce your risk for diabetes-related eye disease? Not confident, somewhat confident, and very confident. Thank you for staying with us and providing your feedback. We offer many thanks to today's experts, as well as our support vendors and visionary partners in the Focus on Diabetes initiative. This concludes today's program in the Ask the Experts Q&A series. Stay well.